Good afternoon, everyone, and welcome to our February edition, our first February edition of the Spotlight series here at the World AIDS Museum and Educational Center. And I'm really excited today. I'm Andy Ruffner, the Director of Education and Programming, to have with me Val Thomas, who is our public health intern right now this semester. But the way that we first met Val here is in her role as a prevention manager at Broward House, one of our local AIDS service organizations here in Fort Lauderdale. And it occurred to me, it would be really great to talk to Val about entering a career in HIV. So Val, it's so great to see you today.
Thank you. It's nice to see you too.
Yeah, so we get to see each other during the week, but at other times, but this is special to have you here on the Spotlight. So I really appreciate you agreeing to do it.
I appreciate the opportunity.
Great. Well, what I wanted to start with, we always start out with is because of the museum focusing on history. For yourself, tell us about your first recollection of what you heard about HIV and AIDS. When did you first hear about it? What did you hear?
So I was born in Haiti, and I'm Haitian. I'm from Haiti. I moved here when I was about 4 years old, but I think one of the first, if I remember correctly, I was signing up for elementary school, and I remember one of the teachers kind of made a comment, it's like, "Oh, you're from Haiti," and she spoke to someone else next to her and was like, "Yeah, you know, the HIV rates in Haiti is significant," but I was probably like 6. So I'm like, I have no idea what that meant. But now that I look back, that was probably the earliest memory I have of hearing anything about HIV. But the one that is a core memory is more so when I got to college years later. It was like 18 plus years later when I went to college, and I was studying public health. And one of the first classes that I took was sex health and decision making. And that was probably my first actual idea of what HIV is and who's affected and how it's transmitted, and just the in-depth information regarding HIV. So that was my first real exposure to it. Obviously, you talk about it like high school, sex ed, barely. But that was my first introduction to how HIV works. And that's kind of where I got passionate about it.
Wow.
Yeah.
So what was your major in your undergraduate program?
So in undergrad, I went to the University of South Florida. I started off as a pre-med student because I wanted to change the world. I wanted to help people. And I thought the only way to help people was to be a doctor or a lawyer, which is, if you meet many immigrant children, they'll tell you the same thing. So I was like, oh, you know, I'm going to be a doctor because I want to help people. I want to make changes. And then I went to see a faculty advisor the second semester of my freshman year, and she was like, "What do you want to do?" And I was like, "Well, I want to be a doctor." And she said, "Anyone can be a doctor. You can get a business degree and take the MCAT, and you could be a doctor and go to medical school. But what do you want to do?" And I said, "I want to help people. I am from a third world country, and I see the needs from that country. I've seen documentaries about how pennies can save the lives of children, you know, to provide vaccines, you know. In the United States, you can go to the emergency room and they're going to treat you regardless of whether or not you have insurance or if you have money to pay for the services. But in a lot of countries, if the money is not there up front, those people won't get the services that they need, and they'll go home sick and basically go home to die." And so I was just explaining to her all these passions that I had and all these things that I wanted to do with global health. And she kind of told me, "I think public health might be more your speed. I think that might be where you might want to be." And she's like, "Look into it." She sent me like the course catalogs, and I was like, "Whoa, wait a minute." And then I learned like epidemiology, and I saw just all the different parts of public health, and it was just amazing. And I was like, I could do so much because when you're pre-med, it's more science and math, science and math, science and math. But one of the first public health classes I took was Black Women in America. And I was like, I didn't even know this class existed. So that was a beautiful thing to see as well. So that's what I studied. And a long-winded answer, that is what I studied in undergrad.
You know, one of the reasons I was telling you when I asked you to do this is we don't get a chance to talk that often. I can't think back. We started the Spotlight series back at the beginning of the pandemic. And I really don't think we've talked to anybody that is a young professional, still in their 20s, who chose their way into this. And I think that that's a really significant thing and something really important to talk about how did somebody get kind of motivated into that. And I love that earliest memory. I want to come back to that because I don't want to just gloss over that. You and I have talked about this as well, but this whole thing with the associations of Haiti with, you know, what's one thing that people know about Haiti? And to have that come up for people that the first place that they go is, oh, HIV. From that, when they have a 6-year-old standing in front of them, I think that's really crazy to me. What other kinds of things like that, talking about Haiti in your experience, what did you hear that over and over then from then on, or?
You know, I think a lot of like growing up in the time that I did, obviously I'm still in my 20s, but it was kind of like shameful to be Haitian in a way. So a lot of times people wouldn't even share that they're Haitian or that they're from there, their family's from there. Well, fortunately, I guess in a way, I never heard that again or the association again up until I got to college and was doing my own studies. But that was the first time someone said it, and it was like, oh, you know, it's a very poor country. There's so much high rates of poverty and HIV and all these things. That's the only time that you kind of hear. But it's a beautiful country, and there's so much that comes out of it, and there's so much history there. And then the correlation with HIV. If you don't know, of course, you're gonna just remember the 4 H's if that's what you're familiar with. And that teacher or that advisor, whomever she was at the time that I was signing up for school, she was a much, much older woman. And so I kind of credit it to maybe that's what she knew and she didn't know better. And so I never thought more about it until I got to college and I was like, wait, that's such a negative correlation for such a great country, if that makes sense. So obviously every country has their issues, their problems, but from what I know and the history of it, it's a great country with great people. I hate that that's the connotation that's associated with it, especially when talking about HIV. But throughout my life after that, I didn't really hear that correlation until I got to college and started working in this field. So I guess there's that upside, but not that great, but still there.
No, yeah, I mean, yeah, there's all different ways that we will kind of classify people and characterize them. So it's hard to escape some of that. But so thinking about, I think it would be great for you to talk about, you know, what kinds of stuff are you doing in HIV prevention now in terms of, you know, you're managing this program for Broward House. What's the range of activities that you're covering in that?
So I'm very fortunate to be in this position, just to be my age and still be in school and still have the opportunity to work with such great people who are doing such amazing things. I think my day-to-day in prevention changes. You know, it can go from testing and counseling. Someone comes in and needs testing or has questions. I'm there as an educator or as somebody who can say, oh, well, let me introduce you to someone who is going through something similar or has been through something similar. The work that we do here and that we're doing at the museum as well is just raising awareness, getting people to talk about HIV. There's nothing wrong with having HIV, and opening that conversation, opening that dialogue will help us with reducing rates of HIV or new HIV infections. Will help us reduce the stigma and bias that's associated with HIV, so that when people hear the conversation, they're more willing to say, oh yeah, let's talk about it. I get tested every 3 months, or, well, I'm not sure where to go. I'm not sure about the information, but I know that I can go to Broward House to get that information. I can go to the World AIDS Museum to learn the history. So that's kind of like my goal within the work that I do. Yes, testing is great. Yes, getting people to know their HIV status is great. But if we're not opening the lines of communication and increasing the dialogue surrounding HIV, which includes, risk reduction, which includes prevention, this includes sex and condoms and all the things that's associated with HIV, but it also includes talking and confronting stigmas and biases. So that's my daily goal, I guess, as a preventionist, a public health person, an HIV prevention manager, just a student of life. Like HIV changes every day, and I'm learning different things that I didn't know as well, because information changes. But we know that HIV doesn't discriminate. It's one of those things that you're not susceptible. You're not less susceptible because of your status or how much money you have or things like that. So my daily job profession is just increasing the dialogue and giving the people who work here the opportunity to do so as well. But I'm also learning. So I learn new things from clients and staff every day. And I think that's the greatest part of working in this field and the public health field, especially focusing on HIV, is that there's always information and knowledge to gain. But what you do with that knowledge and who you share it with and where it goes is what matters.
Mm-hmm.
Yeah.
Yeah, definitely, definitely. Well, I mean, I think that whole range of activities, starting from this sort of individual approach of when you have somebody sitting in front of you who's getting tested and trying to talk to them individually about, hey, what kinds of things are you doing? What are you doing to protect yourself and that type of thing? That's a really powerful intervention. And then there's this other side that you're talking about the whole in a group setting, being able to have a conversation about, hey, this is something that's in our community. What do we think about this? And get folks to do that and that type of thing is really challenging. So where does the museum come in? You've been here with us for a while now. What do you think about what the role of the World AIDS Museum is in all of this?
So yes, I think with the World AIDS Museum, it provides that background history that a lot of people are not familiar with. So everyone has questions, where did HIV come from? Why is it such a huge topic of conversation? And then just the progress of how HIV started or when we first learned about it to what does it look like today? What have we achieved with medication? What have we achieved with treatment? Being undetectable, where do we get that information? I think the museum provides that in-depth, hey, in this decade, at this time, this is what the world looked like, the world of HIV looked like, and this is how we've gone. So from then to now, how did that become this? Where did we start from, and what work has been done, and who did the work to achieve where we are now? People went from taking 20 plus pills a day just to make it to the next month to now they can take a pill a day and they're undetectable, and the risk of transmitting HIV is significantly low. The museum kind of provides that in between, how do we get from taking so many pills to taking one pill, and what does the future look like of HIV? And I think it not only does it increase that dialogue with things like this, with having conversations with local people in the community that is doing this work every day, but it also highlights, the important historical factors that come with HIV. A lot of times. And then I think it also provides the visual. So people are different learners. So coming into the museum, not only do you have the written things, but you have pictures and paintings. You have pop culture references that, that might speak to someone more than, reading about antiretroviral therapy, seeing photos or reading books, just the different aspects of how we can increase our knowledge, but the different ways that we can do so. So not everyone is a visual learner. Some people like to read, some people like to hear things, and you guys do film series and oral dialogues, which provides all aspects of education to whomever needs it. And I think that's where the museum kind of bridges the gap between prevention and education with that knowledge. And I think that's kind of why I wanted to be an intern there, because it kind of takes the work that I do every day and puts a history and the knowledge behind it to see how we came from then to now. And I think it's amazing to be able to work in HIV, but also intern in the HIV world as well, if that makes sense.
Yeah, no, I think definitely, that certainly resonates for me. That's what we're trying to accomplish here. And I think we get to see that in these little aha moments, when you see somebody, it registers on somebody's face as they're walking through and they're like, oh, that's where that came from. And like you said about the number of pills, we've got a pill chart that we show to make people understand where we've come from, because there are people who come into the museum who, you would be surprised how many people come into the museum thinking that all of this is over. And that's one of our hashtags. It's not over yet. And when we go out in the community, I think that's been the hard thing for me. And that's what's so interesting to me about someone young being in this. Having been in it for so long and being used to talking about it, I'm surprised when I meet people and you can feel this sort of like taking a step back when I tell them what I do. And that you get that too?
Yeah, so often.
Yeah. So do you feel like you get that with, is there a difference between when you're talking to older or younger people, or, because that's one of the things that we're always thinking about is, how are we reaching these different communities of people? And so do you sense a difference at all between an older?
So I think for me, there is, I talk to different people every day. We do groups, we do outreach and things like that. And you kind of always know who's going to answer what or how once you tell them, hey, would you like to get tested? When's the last time you got tested for HIV? Do you want some condoms? Just basic introductions of like, oh, what do you do? Oh, I work in HIV. I'm an HIV prevention manager. And I find that high school age or school age kids, students, are very open to learning, are very like, oh, like HIV, oh, I think I know what it is. And they have the knowledge. It's not like secured yet, but they have an idea of what HIV is, or sexually transmitted infections, or just sex in general, having conversations about what that looks like, protection, transmission, and things like that. I find that talking to people, especially within my community of the, West Indian, Caribbean culture, especially older Caribbean people, it's like, we don't talk about that. That's not a conversation that we have, we don't need to talk about that. That is personal. And that's not a conversation that I want to have. And unfortunately, it doesn't help anyone if we're not having the conversation. So now we have a domino effect of, well, we don't talk about this until it's time to talk about it. And by then it's too late, So I see that aspect as well. I know for me, when I talk to my friends and just saying, hey guys, like, when's the last time you got tested? Hey, or even dating, you tell somebody what you do and it's like, oh, okay. My mom, like when I first started working in HIV, I would have droves of condoms with me because I would come from some type of tabling event or whatever. And now she's okay because it's been years, but she used to just wait. Why do you have this? So just that dialogue of conversation, it just throws you off sometimes. But I rather have the uncomfortable conversation because I know the information. And if I leave here because you're uncomfortable, if I refuse to have the conversation because you're not comfortable with having it, then I'm doing a disservice to you, if that makes sense. So, but I see the different aspects. Sometimes I already know how people are going to answer. I already know their reaction. I already prepare for it because I'm like, yes, that's what I do every day. This is what I do. This is what I talk about. And hopefully they're receptive a little bit. And that's kind of where I am with that.
Right. Well, this always goes so fast. We're kind of toward the end of our time. I really want to thank you for opening up about that aspect of it, about talking to people and seeing these different reactions. That's really cool. I think one of the things that it's number one, it's very humbling for me to hear you talk about these things and have it so together at this age.
Oh God.
I think about myself at that age and I thought, oh, I don't think I would have sounded that together and that clear about what this was all about. But and maybe not even now. But the other thing we always like to end with is to ask, to kind of round out. So when you're not doing this great HIV work that you do, what do you do to recharge? What do you do to take care of yourself and get the energy back?
That one is like I like to travel, I guess, as often as I can, get new experiences. I'm an introvert by nature. It might not be hard. It might not be easy to tell from this interview, but I do enjoy, I do recharge from, alone time and just being by myself. I like trying new restaurants and new foods and, taking people's recommendations, like where should I go and what should I eat? But I find it hard sometimes, especially in the work that you do. You just never know people's stories and what they're gonna tell you. And sometimes you take that home with you. And so I have to find new ways to remind myself that I did as much as I could and I helped as much as I could and I provided as much information as I could. And hopefully it makes a difference in their life. But I recently started therapy, so I think that is beneficial. I recommend it for everyone. But those are kind of different ways. I don't have like specific, like I journal or I paint or anything like that. It's more so like I like to just go to new places, experience new things, and hopefully and then surround myself with supportive people who are building me up and saying, hey, we're here for you. What do you need? Let me take your mind off a bit. Let's crack some jokes and have a good time, because on Monday morning, you have to do it all over again.
Right.
Yeah, just preparing for that.
Yeah. Well, those are all good tips, for all of us. I mean, I think that it's really striking to me just the having quiet time to yourself when you're giving of yourself to other people, just by putting yourself out there, answering questions, having the difficult conversations. That's the start of the whole thing. Because if you can't get away, how are you ever gonna be able to get that back? And take a rest and just contemplate a little bit. So that's really cool. Well, Val, I really appreciate you doing this with us. We get to talk a lot, and it was just a little brainstorm that I had. I thought we really need to talk about how do we get more Vals out there in the world.
Oh my God.
And encourage that seriously. And I loved hearing about the sex ed class that you had that sort of started the conversation, and that certainly, tell us the name of that again.
I'm sorry, one more time.
The sex ed class that you had in college. It
was sex health and decision making.
Sex health and decision making, which is really, you and I talk about this a lot, that people have some weird idea about what it is that we do in prevention or in doing sexual health education. And really, it is much more about decision making and communication than it is about the actual mechanics of sex, because that's actually pretty easy and straightforward.
Honestly, but people don't understand that.
Yeah, but it gets a lot more complicated when you start getting into how are you thinking about yourself and how are you communicating. And so we just are really grateful for your work in that. And I know I, for one, cannot wait to see what happens for Val Thomas, MPH, which is coming up and beyond. And I just really appreciate you being with us. So that concludes our interview for today. Thank you for coming. And we will see you on our next Spotlight series here in February. Thank you.
All right. Thank you.